People normally tend to say that pharmacology doesn't have a great future.
This is totally wrong.
MD Pharmacology people are actually becoming great entrepreneurs also.
You must have seen many companies like Practo, Liberate, and
What do you think will be the 10-year future for this branch?
the future is very good, just like any other branch. But pharmacologists, they are getting more attention and they are getting more recognized.
There was a rumor in between that, B Pharmas are replacing MD Pharma.
Now there is a myth actually that B Farm and MD Farm people can do same thing.
Now, what are the parameters that student needs to keep in his or her mind that how to judge whether this institute is good in pharmacology or not?
It only depends upon one point, that is
it worth taking pharmacology from a private college?
taking pharmacology from a private college will be a risky thing.
Now, which are the best paying jobs in the pharmaceutical industry? How much can an MD pharmacology earn in our country? Before we start, who is going to be the today's guest? I want to express my love and a big thank you to all of you. Because of you, the channel has become a success. So thank you so much, everyone. So today we are going to talk about a very underrated branch, pharmacology. People are apprehensive about it. People have a lot of myths in their minds, and there are rumors all around that this branch is a dead branch. There is no future. We have got a specialist. Let me correct, a super specialist for you. He is a graduate from the prestigious Maulana Azad Medical College with a gold medal. He has done his MD Pharmacology and DM Clinical Pharmacology from the prestigious PGI Chandigarh. And he is a person with almost 12 years of being an educator in the NEET PG and FMGE field. He is Dr. Ankit Kumar. And today we have discussed every possibility about how this branch has so many myths, and we are going to break the myths. We have discussed how you can set up a pharmaceutical factory to make generic drugs. Is pharmacology actually a saturated branch in our country? Is there no possibilities apart from clinical research and academia for whom this branch is best suitable for? And of course, the most demanded question, how much can an MD pharmacology earn? So let's put our hands together, and to break the myth, let's invite Dr. Ankit Kumar. Welcome, sir, to the Nachiket Bhatia Show.
Thank you, sir.
Thank you for taking out time.
So my pleasure, sir. It's been very happy to meet you again.
Thank you, sir. Always my pleasure. So today we are going to talk about pharmacology with you. It is one of the most underrated branches. Students have a lot of apprehensions, and they often get confused whether this branch will be actually worth it. And you are the best person to guide each one of us, because you have a not just an MD degree in pharmacology but also a DM in clinical pharmacology, that too from the prestigious PGI College of Chandigarh. But before we move on to the pharmacology part, I would like to know more about you, the beginning of Dr. Ankit.
So my beginning, sir, was not a kind of a heroic thing and nothing. It is just like any simple person who starts. I basically belong to a business class family. And I chose medicine as a career just because I love to study at that time, 11th and 12th, like any other student. Entered into medical field, started liking it. Later on, I realized that now I have to choose a specialization or a particular path. At that time, I was confused, just like all other students. All students, they feel, sir, whether I should opt for this branch, that branch. So I finally chose pharmacology. I had a love because somewhere I love to do theory and research as compared to seeing patients. So I was not very keen in patient interaction. So I chose with pharmacology. And yes, it's a beautiful branch. And the student who join, most of the people, they are not disappointed with this branch.
I'm sure when you chose this branch, you must be having a super peer pressure from your friends, family especially, that why are you choosing a non-clinical branch? You were getting the option of choosing any other branch other than medicine and radio. You had a great rank in your PG exam at that time. So why, how come you still had that confidence to go against the flow and chose pharmacology?
Sir, actually, I felt a little bit traumatic during my internship period. When I was doing that internship in MAMC, it was very hectic. Around in one emergency duty of one intern is working and 400 patient I have to admit. I thought at that time that I can't continue this thing on a very long run. So I thought that what should be best for me? Actually, I should not go towards the branch. I was thinking about myself that I don't want to have much of a patient interaction at that time. So I chose more of a, I'm basically a more of a theoretical or a research type of a guy. And pharmacology, yes, it's a very good branch to do if you are very keen in doing research rather than seeing patients basically.
That's the main reason you chose that branch.
Yes, sir.
So, if I had to discuss the pros and cons on pharmacology with you, what would they be?
So the biggest con, first I'll say the con that you will not able to see patient. And any student I would say who loves to see patient should not opt for pharmacology. Yes, you can have a little bit of patient exposure, but that will be limited when you are doing some clinical trials. As we know that pharmacologists, they are the owner of clinical trials, especially phase 1
Mhm.
trial. Yes, you will able to see the patient, you will monitor them, everything is done. But apart from that, if you have a little bit of inclination towards a clinical branch, I would say don't go for it, because you will not be mentally prepared, and probably you will be causing the branch at that time that you will feel disappointed at that time.
People normally tend to say that pharmacology doesn't have a great future. Now, is that a fact or a myth?
This is totally wrong. I would say pharmacology has a very good future. The first thing which is I think most of the people they confuse is it is not about branch, it is about people. So basically pharmacology, if I would say right now, it is the only sector which is in, if you go through all the industries, whether it is a steel industry or let's say IT industry or let's say pharma industry, this is an industry which never goes into recession. It's grows steadily, and especially during pandemic it has an exponential growth as well. So pharma sector is a very good sector, doesn't go into recession. Now the point is, when you enter into an industry, let's say you're not very much inclined to academics, you enter into industry, and after MD, when you enter into industry, you get a very at par salary,
Mhm.
everything, just like any other resident. But just imagine you are there in an industry for 7 or 8 years. The growth is very good. I have seen many people, many of my friends who are now at a position of VP, CEOs, and etc. And the future is, now you can expect that it will be very good.
What are the potentials of a pharmacologist in a corporate and a government sector?
So if you talk about government sector, it is I think same for every branch. You do MD, you do an SRship, you become an AP, and then steadily you go towards being become a professor or an HOD. But in corporate the things are different. The things, the roles which are required or expected from a doctor could be a different. You can be a marketing guy, you can be a vigilance guy, you can be a medical writer, or you can be, let's say, a salesperson as well, being a doctor. So there the roles are different, expectation are different, and similarly the opportunities will also be different in that sense.
What are the possibilities of an MD pharmacology for super specialization?
The trend of super specialization is increasing. I personally have seen from past 5 7 years many students are opting for super specialization. The one reason is, instead of doing a normal SRship of 3 years, people are rather preferring to do a DM. It will also take 3 years, and doing a DM will increase or enhance your prospect of becoming a AP in a prestigious institute very well. So nowadays, yes, people are opting for DM, and apart from being remaining in academic, after doing DM, the chances of growth or getting a very good package in industry also increases. So yes, doing a DM is always an added advantage over an MD.
Which fields are available in DM for this particular
Right now in
pharmacology?
India, in if we talk about pharmacology, the only field which is available is clinical pharmacology, which teaches you mainly about clinical trials. Yes, if we talk about other countries, yes, there are many ramifications, there are many subtypes of branches which are available in those countries, but right now in India the only thing is clinical pharmacology.
What about fellowships?
Fellowship concepts is not very popular in pharma. There is no niche, or I could say a specific training program. Most of the people they generally opt for a workshop and obtain a clear, simple certificate, but the trend of fellowship is not there.
I have seen that MD pharmacology people are actually becoming great entrepreneurs also. What's the business sense in this field?
Yes, people who are doing MD pharmacology are going towards entrepreneurship as well. And you must have seen many companies like Practo, Liberate, and Farm. many tech companies are growing, and most of the people who have started or are founding members, they are pharma people. So that thing helps actually, because they have a core sense of knowledge about the sector as well.
I think also the way pharmaceutical industry is growing, there's a huge demand of pharmacology people there
Yes,
as well.
pharma sector is a very steady sector. I would say the only sector which will never go into recession.
Mm.
The demand, our healthcare sector is such like that, it never goes into recession. Now with the trend, all those technological advancement, AI and everything we have seen a rapid burst of new drugs which are coming into the market right now. And that is creating a demand for pharmacologists. We have to test this drug. We have to see the adverse drug reactions. So that needs a specialized people like pharmacologists.
So, is there a possibility, since it has become such a niche branch, that it is now super saturated, especially in the metropolitan cities?
I would not say right now it is super saturated. No branch in medicine is ever saturated. The only point is, if yes, if you want to work in a particular area only, you're not willing to change your geography, or you don't want to move to another place where there is a great opportunity, then it could be saturated. But otherwise, there are a lot of opportunities in pharma right now, and people are doing very well in this.
Do you think there is a higher job potential in the second tier and third tier cities rather than the metropolitans?
Not with pharmacology, I would say the good opportunities still in this sector in pharmacology branches in tier 1 cities only. It is not very good in 2 or 3.
What do you think will be the 10-year future for this branch?
If I would say 10 years, the future is very good, just like any other branch. But pharmacologists, they are now are getting more attention and they are getting more recognized. I would tell you an example that when I did my MD in around 2010 or 12, at that time the industry people, they were not seeking a particular person who has a pharmacologist degree.
Hmm.
Instead of that, for that specific place, they were opting for MBBS also, M Pharm also, B Pharm also. But right now, if you see the scenario of the industry, people are going and they are employing mainly MD pharmacologists. So the things are becoming very specialized. Things are becoming very directional
Hmm.
in industrial sector also. And one reason for this is that things are getting highly regulated also. So that is creating a dearth for good specialists like pharmacologists.
There was a rumor in between that B pharmas are replacing MD pharma because they are cheaper workforce and they're more than happy to do the work which MD pharma is doing. Since clinical interaction is not there, it's more of a clinical trial, and companies are looking for cheaper workforce. Now, is that rumor true?
Now there is a myth actually that B Farm and MD Farm people can do same thing.
Hmm.
See, pharmacy degree, its role is different. Those people are specialized in basically drug making and dispensing. And MD pharmacologist, who is a clinical person, he has a specialized role in testing this drug in human subject. Let's say clinical trial. It is a purview of a doctor, an MD pharmacologist also. Legal rules don't allow B farm and M farm people to touch a patient. So, if you want to do a clinical trial, let's say you want to report an ADR, only a pharmacologist or a clinician person, he can only sign those documents. So, this is such kind of a regulatory framework where the roles and responsibilities of these two fields are totally segregated. Yes, people sometimes confuse, but the things are totally different.
So basically, they are not taking over those jobs.
No, no, absolutely not.
That's actually good to know because this is happening in lots of fields, and it's a big red flag if it happens.
Yes.
Boss, what are the opportunities for an MD pharmacology abroad?
Outside India, the research funding is much better than our country. If we say US, Europe, Australia, and pharma is a research branch. So that itself creates an environment of a better future, you can say better pay work for a pharmacologist. Let's take an example. I'll compare with an Indian scenario, a person who has done MD pharmacology joined a pharmaceutical company in India after 2 years of MD. That person is earning 10 times less than as the counterpart in US. So there is a huge difference, and that totally or solely depends upon the funding a person is getting, a company is getting. And the developed countries, they have a good funding. So yes, the future is always brighter on those countries.
So basically, if a person has to choose that if he wants to move to a country Which country would be the best in current times?
Current time US is obviously the hegemony of US will all is was there and it will be there for some decades as well. So the maximum, the best job offers people are getting is from US. Australia is also showing good signs. Many people are moving there. Europe, I would say, would be on the third spot right now.
Hmm. So, do we need to clear any exam or get any license to practice there, or we can simply go and
Uh, this is
start?
this is the beauty in
Uh,
pharmacology. You don't have to clear any exam. You can straight away join a company, start on a work visa, and you can grow there.
since there's no clinical engagement, so we can simply go and start working there.
True. But yes, if you want to do clinical trial on the behalf of that
Hmm.
company, in that sense, you have to clear an exam. And that exam is just requires a 2 3 months preparation. Most of the doctors they easily clear that exam.
Boss, which are the best researchers, like the best demanded researchers in the world, or maybe let's start with India. Best demanded research in India, which a MD pharmacologist should focus on.
See, the best topics or demand for the research is very area oriented. Like in India, there is a lot of funding on infectious diseases
Hmm.
like tuberculosis, HIV, I would say
Hmm.
contraceptives. But if you go to US, their healthcare needs are different.
Hmm.
Those people are spending money on cancers, aging,
Hmm.
skin condition like hell.
Hmm.
So like you must have seen you must have heard about a skin senescence program. They want
Hmm.
to improve the skin quality and they are going giving funding in that sense. So that totally depends where you're living basically. India focus on infectious diseases. If you're going to US, you have a different priority.
And what about clinical trials? Which are the most demanded clinical trials these days?
Regarding clinical trial, the topic of research is similar to clinical trials. So I would say in US, again, the cancer, the brain part, the neurology part, which is still untouched part, is receiving lot of funding. Lot of clinical trials are getting, people are getting doing lot of clinical trials in these two areas. Now, since the advent of many new drugs, especially biologics, monoclonal antibodies, it has opened a new area on cancer research basically, those targeted therapy. And that is a very good research. And I would say that for next 15 to 20 years, there are a lot of opportunities in this area.
What do you think will be the most demanded clinical research for an MD pharmacology in next 5 years?
In next 5 years,
Or let's say next 10 years?
next 10 years, if you are very much interested in research, go in cancer research. And since advent of these small molecules and targeted therapy, a new domain of cancer treatment, there are a lot of opportunities that people are doing, a lot of research is going. For the proof, you can see CTRI registry and you will see lot of phase 1 clinical trials. Request is given to FDA, CDSCO in India, and lot of things are in pipeline right now.
Let's talk about it from a student point of view.
Hmm.
Now, let's suppose a student has just cleared his NEET PG and is getting a chance to take MD
Hmm.
pharmacology. Now, as a senior, what parameters do you think the student needs to have in himself or herself, the characteristics that to be actually be a successful pharmacologist?
As a successful pharmacologist, I would say first have patience. This is such kind of a field that will not give you immediate results because it's a theoretical field, it is a research oriented field, it takes time. It is not something you are treating a patient and next day the patient is thanking you, sir, I have become totally fine. So this kind of reward you will not get in pharmacology. You have to be patient the first trait. Second thing is you should during this 3 years you have to develop a skill because in market the skills are sold. It is not the degree which is sold in market, it is skill. So in these 3 years you have to find your area of interest. Let's say I want to do in pharmacogenomics, I want to do genetic studies. Specialize yourself in 3 years in this field. Similarly, there are many other fields which you will learn that when you enter into MD pharmacology. After 3 years, you start working on it. Whether you remain in academics or in medical college or whether you enter into corporate, work on this skill. And next 2 to 3 years, it will create wonders for you.
That's actually a very well defined answer, boss. So, boss, if a student has to choose this college as their pharma graduate college, Now, what are the parameters that student needs to keep in his or her mind, that how to judge whether this institute is good in pharmacology or not?
It only depends upon one point, that is funding. If an institute is getting good amount of fund, whether it is a private or a government, go for that institute, because you will be having a lot of technical support, financial support to do the research you want to do in MD pharmacology. So
And
go
how
with
to
funding.
know that whether this institute is getting funding or not?
I would say that central institutes
Hmm.
like AIMS, PGI, JIPMER, they are they are autonomous institute and their funding is very good. Second thing is, let's say tier one college like Maulana Azad Medical College, VMMC, CMC Vellore. Again, tier one college in good states, they have a good funding. But unfortunately or disappointingly, I would say, like tier two or three cities, which are upcoming new colleges, right now they have a financial crunch, they have a funding crunch. I would not recommend that you will get that kind of a research experience in those colleges right now.
So basically, if a student has to take, he or she should take only from a good government college.
Yes, pharmacology, I would say only from a good government college.
Is it worth taking pharmacology from a private college?
Taking pharmacology from a private college is will be a risky thing. Yes, there are good private institutes in India who are offering a very good course and curriculum and research topics in pharmacology. But I would say those types of institutes are very limited in India. Most of the private institutes, I would say, it will be a risky affair to opt pharma from there.
So, boss, there's also a DNB pharmacology. Now, is there any comparison between MD and DNB? Is there any bias regarding DNB of any sort, or are they considered equivalent?
So, regarding MD and DNB, it is not limited to just pharmacology. Yes, there are some differences between MD and DNB. That difference also applies in pharmacology. Yes, MD always has an edge over DNB right now, because most of the medical colleges, you will have a better experience. And especially if your field is only theoretical or research oriented field, then it's always it will be better to opt for an MD pharmacology right
I
now.
think it's sad, but sadly it's true. I believe that right now MD and DNB should be considered equivalent, because I think both of them are putting their heart and soul,
True.
and I think DNB always has a more difficult path to go towards success. So, but I think the corporates are looking for more into MD pharmacology rather than DNB. Might be because MD has better academics and DNB doesn't have academics. Is that the reason?
Yes, the difference is there. What you have said, sir, is absolutely true, but it is not a very large difference.
Hmm.
Most of the corporate, yes, they prefer MD over DNB, but that is not a rule.
Hmm.
I would say I have seen many DNB people who are doing better as compared to MD people as well. Ultimately, it settles down to one thing, that what kind of soft skills you have, what kind of approach towards your field you have. People, they do good in corporate, not just on the basis of MD or DNB.
Can an MD pharmacology also consider doing general practice, since they have been away from patients for a long time? So, do you think it's the right step?
Yes, they always have a right to do it, because they have already done MBBS.
Hmm.
Now they have a legal right to do private practice. Yes, many people are doing, if they are not finding the suitable job for some times, or let's say in during that interim period, many people, they do private practice. That depends upon the individual aspiration. Most of the people, they are not willing to go to some other city, they are not finding it very comfortable in a corporate environment as well. So ultimately they chose this path as well.
Imagine you're talking to a new JR1 entering their first day as a pharmacology resident. Now, what would your advice be? How they should chart the next 30 years of their life? The right steps, the right decisions, what should they be?
I would say the first thing I would tell to my junior or JR1 is, be patient. It's a long journey.
Hmm.
You cannot climb an Everest in one day.
Hmm.
It takes time, and
Hmm.
great things always take time. So first, be patient. Second thing is, build your knowledge. If you have good knowledge, you become much more rational as well. And when you become rational, you can decide what is good for you, what is bad for you. And when you decide what is good for you, you work on that thing, you develop a skill. And that skill will guide you in future that what I have to do in next 4 or 5 years. But one thing is there, the skill needs change, adaptability as well. So patience, keeping your head down and doing hard work are the two very important trait I would say anyone who is entering into medical field should have.
Boss, you're talking about soft skills a lot. So, which soft skills are a must for actually being a successful pharmacologist?
So it's always said that communication is the key.
Hmm.
So first thing is communicate. How you communicate to your people, whether you are in a medical college or whether you are in an industry or in corporate, communication is a very important thing. Second thing is how much presentable you are, how much analytical capabilities you have, the problem solving part, the reasoning part. All these things I hope most of the MBBS student they develop during an MBBS, and yes, it gets much more enhanced during their MD, and that things help a lot. So I think everyone who is doing an MBBS, MD or any other field should focus on these skills as well.
So, boss, if a MD pharmacology wants to transit into the entrepreneurship field, maybe like move into healthcare, move into a pharmaceutical company, what which route should they take? Like after a SRship, should they move there, or whether they should wait to a couple of years in a government college and then move out? What's the perfect route for them?
I would say there are two ramifications. If you want to enter into medical field, it's better to do an SRship or DM, and surely you can become an AP there. So this is a very simple story. I believe all the medicos must be knowing it. But the thing most of the people don't know is how to enter into industry or become an entrepreneur. I would say that after you have done your MD, and if you are very sure that I want to enter into a corporate or an industry, there is no point of doing SRship at that point. The simple reason is, let's say your salary is 1 lakh rupees when you entered into SRship, and your salary is 1 lakh rupees. Let's say you entered into a corporate. After 3 years, and then you will become an AP. Again, you will be starting from 1 or 1.2 lakhs.
Hmm.
But if you spend this 3 to 5 years in industry,
Hmm.
and if you are good at it, easily your salary will be more than 2 times. Apart from salary, you will be in a better position. With better position, you will have a network, and if you have a network, you will grow drastically. So I would say, if you are very clear that I have to go into corporate, don't do SRship. Next day after your MD gets completed, join a company and learn what you want to learn there.
Boss, we come to the most demanded question of our podcast. How much can an MD pharmacology earn in our country? In a government job and in a corporate job or a pharmaceutical job 2 years down the line, 10 years down the line, 20 years down the line.
An MD pharmacologist want to pursue academic career, he will first do an SRship, he'll become an AP, and down the line he will become a professor. The structure is very well known to every student. Let's say 1 lakh rupees in in Delhi. I'll take an average.
Hmm.
After MD, you join an SRship, 1 lakh rupees. You become an AP, again you come back to 1 lakh rupees. Then you have a steady growth of income of 8 to 10% per annum. That I would say will match your inflation part only. And yes, slowly and slowly you will grow. Let's talk about now corporate. In corporate, let's say you will easily get a job of 20% higher after completing your MD, because industry people always want to match the standard of a government salary. So let's say after MD you get a job of 1.2, expect this growth to be double in next 3 to 4 years. If you work honestly, in 3 to 4 years you will easily come to 2 lakh rupees. And down the line, when you come to a certain level, let's say you have become a manager, or you have become uh, at a very good position, your growth starts down the line after 7 to 8 years, after you have remained in that industry. After 7 to 8 years, you will see an exponential growth in the sense that you will get a bigger role, bigger opportunity, and with bigger opportunity you will get a handsome salary as well.
So, boss, if we had to basically summarize, so which are the best paying jobs in the pharmaceutical industry?
Right now the best paying job is in marketing field. Many doctors will find it very difficult to do it because it's a very hard field. Your lifestyle will be hampered.
Hmm.
And if I talk about the next good field right now is vigilance, pharmacovigilance. The good thing about pharmacovigilance is it's a desk job, and you see a steady growth. And in pharmacovigilance, the good part is that with each years of experience, you get a very good position in vigilance also, because the regulatory part, it demands certain positions to file a report. Let's say an FDA, or let's say the government want to see whether a drug is performing well or not. So there are certain positions or roles in an industry that only this level of a person can file a report to our government. So vigilance again is a very beautiful option if a person wants to do it. So marketing vigilance, they are doing good right now, and they are tend to grow. They will tend to grow.
Boss, what are the non-traditional ways in which pharmacologists are also earning money?
That is entrepreneurship always.
Mm.
That being an entrepreneur is the best and the non-traditional way if they want to earn money. Many people I have seen, they have started their own business. They have started from a single room, and they have created a kingdom out of it right now. So this is the best way. Now the students will be asking, sir, what type of entrepreneurship? Remember that will you will only able to understand when you will enter into that field, that in which area I want to go, whether I want to focus on the drug part only, whether I would like to rather go into the material part, let's say machines, let's say other medical supplies. Apart from this, there are many back end jobs also, like blockchain technologies have entered into your pharmaceutical sectors, the AI part has entered into pharmaceutical sectors. So those fields are now becoming very much diversified, and many lot of pharmacologist people, they are entering into that field right now.
What about freelancing in this field?
Regarding freelancing, I would say the teaching part, which I
Mm.
used to do, is a great opportunity that will help you to teach student if you have a passion for the teaching. Apart from freelancing, many people are becoming medical consultant as well, and that field is right now very much booming in regulatory part. Many pharmaceutical company, they need regulatory approval to sell their drug, to take license, so they need an expertise consultant. Many pharmacologists are doing freelancing in this medical consultation field as well.
Boss, I'll ask you a prediction question now.
Yes,
So you have seen the complete field for so many years now. You understand medicine, you understand pharmacology, and as an educator, you have seen everything. So now, what would you say? Which are the top five fields in the field of medicine which will have the best potential in the next 10 years? And you have to tell us the specialities as well. For example, medicine won't work. It has to be cardio, gastro, whatever it is.
I would say that all field have very good potential right now, but always I would say the neurology field has a very upcoming future. I think the brain part is still a very unexplored part, and many people are doing a lot of brain research. The second field I would say is PSM, the preventive and social medicine. People are becoming very much aware, and they are now more into preventive strategies. So PSM, I would say, would be the second one. The third would, I would say, is dermatology. Everyone loves to look beautiful, and derma, we have already seen that it has shown a lot of growth in past 5 to 10 years, but I would say next 10 years again it will tend to grow. The reason is the technologies are becoming advanced. The fourth field I would say is cardio again, because lot of tech is coming now to improve the heart conditions. Fifth, I would say, always and always surgery, robotic surgeries, laser surgeries, gamma knives, many things are coming. And but I would say, if I would like to tell you a controversial thing, that which field will see a little bit downfall. In downfall, I would say the radiology field might see a little bit downfall. AI is taking a little bit takeover of it, and it is now very precise, very accurate. So that could be one thing I am a little bit worried about.
True, something can happen.
Yes.
But boss, let's move on to some questions which were basically put by our students for you. So this is basically the student section. We were asked almost more than 100 questions. So the questions we have we tried to cover them in our normal questionnaire. Some questions were a little bit unique, so we have got them for you now. So the first question again is the abroad opportunities after MD pharmacology from India.
Go for postdoc after doing MD. After postdoc, You can become a scientist or directly enter into an industry, a good company, very good opportunity, very bright future.
Career prospects in pharmacovigilance.
Pharmacovigilance, the career prospect for the next 10 years are beginning to slow down. The main reason is AI and tech. So vigilance is a good field, was a good field, but it might see some resistance in next coming 5 to 10 years.
That's actually a very good answer. Thank you, boss. Can an MD pharmacology graduate and start a pharmaceutical company? How to start on a small scale?
I would say start from your garage, start from your kitchen, start from any room you have. Just learn how to start. Let's say what are the technical requirements, legal requirements, its social implications, and you can start any company from anywhere. The world has become now a single place. You just need a table, desk, and laptop, and you can create wonders out of it.
And if a person wants to start, what basically drug should they first focus on?
That depends upon the amount of funding you have right now. If you don't have a very big funding, start from generic. If you have a good amount of money in your hand, you want to start from some novel therapeutic drugs, especially monoclonal antibodies or new upcoming drugs that has a lot of potential. The company, if a company especially has a patent for it, then it will be good for you because you will find it very easy to sell in the market. Initially, if you want to sell a drug, you can only become a distributor for a company. So you can start from there, and slowly you can increase your portfolio or your basket.
Normally, I've seen a lot of people are just, making generic drugs and then selling it to the main big companies, the pharmaceutical companies. They put their brand and they sell it like that. Now, if you want to start a generic drug, which specific drug should a new person start with?
I would say if you want to start with generic drugs, see the essential list of medicine in India. So there are around 300 to 350 drugs, and these drugs are very routinely and commonly prescribed and taken up by the society. Start with this. The reason is it will always have a great demand. It will never see a slowdown. On the background of it, we can start our innovative product. If a person wants to start, he can add one or two drug which is specialized, which could be a specialized product for that company, and start selling it. Initially start with essential drugs.
That's what. And boss, how much capital does it require to basically start making a drug like that?
That depends upon your network. If you already have a good network, you can start your company, I would say, from 15 to 20 lakhs also. If you have a greater network, that will be a
What do you mean by good network? Basically, what does it a person require?
network means that the people who are buying your product, let's say
Okay.
if you have a good contacts in hospital, you have a good contacts or a group of chemists who are selling your drug, then it will be very much easy for you. You don't need a much capital for it. The reason is your transactions will keep on going, so you don't have to hold your capital, you don't have to hold large capital in your hand. But yes, if you're starting and opting for a costly drug for a rare disease, let's say, then it will be a difficult task to start as an initial small time, I would say, entrepreneur.
They already have a big capital and they want to make a drug which is rare, all right, which has a rare demand. So, based on that, those kind of costly drugs, which one do you think has the highest demand amongst the rarest drugs?
Yes, I would say right now there is a trend of monoclonal antibodies going on. Many new protein or targets on cancers, Alzheimer's, or any disease you take right now. We are just finding an antigen, we are making an antibody just like this. Many new antigens are getting every day discovered. Similarly, we are targeting it with monoclonal antibodies. And if you want to start, I would say start with Alzheimer disease, a great potential. And similarly, there are many other diseases. Upcoming drugs are there in pipeline. I would say we have to find an area of our own specialization. Go with monoclonal antibody. It will be a hot selling cake at today's time.
And I think I can add a little bit here. So, guys, if you are ever thinking of making something like that, boss has said something very right, which is the network. You have to first, if you are making a generic drug, you first have to find a buyer. So, if you have a confirmed buyer, you simply make what they are demanding. So, I know people who are just making ORS in tons and then supplying it to the bigger pharmaceutical companies. And they're making plethora of money. So it's not about that we are making a great drug. You just simply have to know what the market needs, find a good buyer, then start making things. So that way, your pharmaceutical setup is already set.
True.
So, boss, moving on to the next question. And whoever asked this question, it was a wonderful question. Thank you so much. Okay. So, why does pursuing MD Pharmacology from Mumbai or Delhi offer more advantages than other cities?
Again, I would say the same answer. Doing from Mumbai and Delhi, you will get a good funded institutes. Pharmacology is all about funding, because in pharmacology, it's all about research. Research is all about funding. Delhi, Mumbai colleges, they are very well funded institute. So it is always good to do MD pharmacology from here.
Is pharmacology well suited for females? Why does everyone suggest that that females should take up clinical branches instead?
Actually, if we say the gender ratio, there are more females right now in pharmacology. And the one reason is there are no night duties in pharmacology. So many females, they prefer to take it. But it is not a gender specific field like some other fields which people might consider. Females are more right now in pharmacology. And the good thing is you don't have to go here and there. There are no night duties. It is a purely desk job. So people, they used to love this. Some people, they love it, who wants peace in their life.
Thank you so much, boss. And now we move to our rapid fire round. Okay, quick questions, quick answers, and super truthful. Simple rules. All right. What was your dream job as a kid?
I was interested in planes. I want to become a pilot at that time.
Okay, we have the second guest today who said
Okay.
pilot. What was the last show you watched?
I was watching a movie named Invictus yesterday night.
Okay.
So it's about Nelson Mandela at the time of apartheid or partition. So it was a beautiful and inspiring movie.
अच्छी है. Dream travel destination.
My dream travel destination would be Iceland, just to
Iceland.
see the
Northern
auroras
Lights.
there.
What's the one country you want to visit but haven't yet, apart from Iceland?
I haven't been to New Zealand right now.
I'm telling you, the most beautiful place on earth.
Yes. So
And the nicest people.
yes. So it's in my bucket list right now. That
15 days and you will never ever come back from that place.
Yes. Yeah.
Allah, I've never been to a more beautiful place than New
Yes.
Zealand. What is your end goal in life?
The end goal is not to hurt people, and this is journey also and end goal also. Just be compassionate, be loving, because whatever we are doing right now will be left here. The only thing how you can create legacy is just to remain in heart of people after you're not there. So that is my end goal.
True. Happiest moment in the life of Dr. Ankit.
Happiest moment was there are many happy moments in my life, but one was that when I started my own company, actually it was very struggling and emotional time for me. I was having mixed of emotion, and that was the happiest moment for me when I started my own company, and I very grateful for that I did something.
Thank you so much, boss, for being such a wonderful guest. I think you have decoded pharmacology for us. And I absolutely love the insight that you have given how to set up a pharmacology, drug making setup. So I think that's one of the ground realities that, people do want to know, but they never get to know. So I think through this podcast, we have given them that ground reality. And I think we will actually help somebody through this podcast. So thank you
sir.
so much for that.
Thank you very much, sir.
And guys, I hope you have loved this podcast because I have loved every word of it. Very real, very honest, groundbreaking. I would describe this podcast like this. So, who do you want the next guest to be? Please put it in the comment section. And as usual, you can message them to please come on the Nachiket Bhatia Show. And I guarantee you, we'll have a scintillating conversation. With this, I bid you adieu. Thank you so much. God bless you. And don't forget to like, subscribe, and share. Thank you so much, and God bless.